Concierge medicine, at first, I looked at it like it was almost like cheating. And as I'm practicing in the office, as I'm rushed to see patients, I didn't have the time to really invest into the patients the way I wanted to. I didn't have the time to coordinate care with the specialist. I didn't have the time to really project out what needed to happen more than just before the next visit. And so doing concierge work allows me the luxury of really investing a lot of my time and a lot of my energy into each person's outcome, and being a team leader with the consultants and inspiring patients to really move forward with their care in a way that's proactive and not reactive. And what I begin to realize is that if I invest in my health, I will inevitably prolong the quality of my life as well as hopefully the length of my life. Not for myself and my own selfish interest, but I have kids and I want to see them graduate and I want to see them get married and I want to hold their babies too. And that all requires me today, right now, investing in my health and my wellness so I can have that health span and lifespan to allow me to spend time with the people I care about the most. I acknowledge that primary care does not sound sexy, but it's really foundational to your health. What I've seen in my practice is that a lot of patients will focus on quick fixes, and they'll overlook the foundational principles that really support a long and healthy, wonderful life. Key things like sleep and nutrition and exercise and movement. And then on top of that, mitigating risks like cancer and making sure that your biomarkers point you in the right direction in terms of diabetes and other markers that we track. Functional medicine sounds great, but a lot of people skip over the core pieces that they have to work on, and they want to just get to the really cool sounding stuff. And what I've found that if you take really good core medical principles from primary care and you marry them with really awesome precision medical tools that allow us to really juice the system and get a little bit more out, that together you can get a really high quality, very productive life out of it. And that motivates me. I want to see all my patients actualize and be the best versions of themselves and do the things I really want to do. In the end, your time is so precious. And I don't want my patients trying to figure out, should I take this supplement? Should I worry about that peptide? Do I even need to care about my blood pressure? What I want to do is I want to be essentially like a health guide. And I want to help people on that journey and optimize their approach and help them make every step in the right direction.